Good evening, everyone. I'm Don Liacata, the Chief Program Officer at NAMI Davidson County. I want to welcome everyone to a education session. Tonight we are welcoming Mandi Ryan from Centerstone. She's going to be talking about where body and mind meet, understanding the intersection of mental and physical health. So without further ado, I'm going to pass off the presentation to Mandi. Welcome, Mandi.
Great. Thank you so much for having me tonight. I'm going to go ahead and start sharing my slides. Great. So I just wanted to come to you tonight to talk with y'all about where body and mind meet and understanding the intersection of mental health and physical health. My name's Mandi Ryan. I've been with Centerstone for a little over 12 years. It'll be 13 years next month. I am a nurse by background. I've been a nurse for 25 years. And initially, when I first became a nurse, I worked more in physical health. I worked for Open Heart on an open heart transplant team, and I worked with a lot of other inpatient hospital programs. And I moved into becoming a corrections nurse for many years. And that's where I really started working with individuals who unfortunately had been arrested but had mental health, substance use. And I really got to see where all the mind and body really interacted. So I'm very thankful that I could come here today and be able to talk with y'all. So I'm going to start with our next slide and move that over. And so when you think about it, mental health and physical health really go together. When an individual experiences chronic stress or anxiety or depression, their body responds physically. Your heart rate may increase, your cortisol may rise, your sleep gets disrupted. You may even notice that your immune system can decline. You might see yourself getting sick easier. And on the opposite side, when an individual might have like a chronic illness, they might begin to feel hopeless or have anxiety. And that's because the intersection is really bidirectional. What affects the body affects the mind, and what affects the mind affects the body. They go hand in hand together. And so, why does that body and connection, mind and body connection matter? When mental health conditions go untreated, individuals are less likely to engage in preventative care, manage chronic illness, follow the recommendations that their doctor has given them. So, like for example, if a person has untreated depression, we can see that reducing motivation, making it harder for someone to go to the doctor, to keep those appointments. Taking medication sometimes seems harder, and you may forget or may just not even feel like taking it. Exercise becomes much harder when an individual has depression. Trying to prepare healthy meals, there's no motivation to do that if an individual has untreated depression. Similarly, if someone has an untreated physical condition, that can worsen their psychiatric symptoms. So, an individual might have chronic pain, diabetes, heart disease, maybe an autoimmune disorder. All of those have a chance of increasing a risk of anxiety and depression. So, really trying to look at the whole person can really improve outcomes. It can increase patient satisfaction, increase patient well being to where individual feels better, it feels motivated to be able to attend those appointments. And when you really look at the holistic approach of the mind and body together, that's when an individual may be able to be more fully engaged in their treatment rather with their primary care doctor or with their mental health doctor. So we always have to make sure that we're addressing both of those at the same time. And that's where you're going to get long-term recovery, increased outcomes, and just overall well-being and feeling better. So, how does mental health really affect physical health? Well, if you think about it, chronic stress really activates that fight or flight response. And so when an individual has that stress and anxiety for a long time, that's going to really increase their blood pressure. It can increase their heart rate. It can cause their blood sugar to go up. It could cause inflammation in their joints, just all over their body. And over time, we can see these activities really contributing to an individual developing heart disease, diabetes, a weakened immune system where they feel like they easily get sick a lot, and then like gastrointestinal, so stomach issues where they're just feeling like lots of stomach pain or maybe nausea and vomiting. So all of that can happen through chronic stress. And anytime someone has a mental health condition, that can really worsen chronic illness. Um, so individuals that struggle with their mental health, they may have reduced energy, poor nutrition, decreased physical activity, and they may even move to increasing some substance use or alcohol use. Another thing that can really be disrupted is an individual's sleep. Sleep is so important to our body to be able to help us be able to repair activities that have happened during the day and to really help you move to where you're feeling so much better. Anxiety and depression really impair the type of sleep we get, the amount, and then also the quality of sleep that you get. And if an individual has like chronic sleep problems to where night after night they're not getting good quality sleep, they're going to be at risk for obesity, cardiovascular disease, just their overall immune functioning. And so sleep is extremely important. And so that's another way that mental health can really impact that physical health. You'll also see individuals a lot of times having a reduced motivation, and that can impact them taking their medication, just doing some self-care activities for themselves. They may start doing other kind of coping mechanisms that would really increase their long-term physical health risk. So it's really important that we look at the way that mental health does impact that physical health. And if you think about it the other way, how does physical health affect someone's mental health? Individuals that live with chronic illness, that really impacts their emotional well-being. So if you think about diabetes, heart disease, chronic pain, cancer, maybe some autoimmune disorders, these individuals end up having like long-term and ongoing management. They're going to the doctor more often. They're having to make a lot of lifestyle adjustments. And if we think about that, individuals with these chronic illnesses, they're going to have frustration, also fear, grief, burnout, and all of that in turn can affect their mental health. And you're going to see individuals having these emotional tolls that are taking on them. And it ends up being like a burden to them. And if you think about having to go to the doctor so many times, keeping up with all those appointments, keeping up with all the medications that they have to take, and then as we all know, a chronic illness can end up causing financial strain on individuals. So not only having to pay for the doctor, but you may have missed work or missed activities to where you're then having a financial burden and strain that then affects other parts of your life as well. And then a lot of times, some of these physical issues and chronic disease can also cause physical limitations. So it may affect an individual's mobility, their ability to take care of themselves. And so that in turn produces stress and in fact affects someone's mental health. And one of the things that you also see at play is that increased inflammation has been linked to depressive symptoms, as well as you might see hormonal imbalances. Your blood sugar can go up and down. And that can be influenced by your mood and how you're feeling. So that really can affect that physical health and your mental health together. Another chronic disease that we see that can really be associated with depression and anxiety is chronic pain. We know a lot of individuals have had injuries in the past, or they may have cancer, or they may have another chronic illness that really causes chronic pain to where every activity that they do causes them pain. And as we know, untreated pain really reduces a person's quality of life. And those individuals, a lot of times will see higher rates of depression related to that. And then sometimes there is that increased risk of substance use when you're trying to medicate that chronic pain with substances instead of maybe medication that you were prescribed. So one of the things we really like to see is making sure that our primary care doctors are screening individuals for depression and anxiety as they're talking to them about any of those medical chronic conditions. And so you might start seeing it now when you go to your primary care physician's office. They're asking you some of those questions that you may have been used to only being asked at your behavioral health doctor's office, such as like, do you feel hopeless? Are you having trouble getting up in the mornings? Do you not have motivation? And so it's great for both of your doctors to really be looking at that depression and anxiety of all individuals, because sometimes individuals may have depression and anxiety, but they haven't started with a mental health provider. And so they may be going to their primary care physician's office. And so that primary care physician can screen them, and then they could treat them or they could refer them to a behavioral health organization. But it's really important that they don't just treat that physical illness alone, because if we're just treating the physical illness and not looking at that depression or anxiety or substance use, then it really does affect the recovery and quality of life that an individual can have. So there's some shared risk factors. If you think about some of the factors that individuals have in their life, these can contribute to both mental and physical health challenges at the same time. So trauma, unfortunately, a lot of individuals have experienced some type of trauma in their life. Some of that could be early childhood trauma that has impacted their stress response, and that is going to increase risk for chronic disease later in life. But as we all know, trauma can happen at any point in our lives. And so making sure that if you do have trauma in your life, that you have someone that you can talk to about that, a therapist, to be able to help you work through any of those trauma incidences that you might had. Social determinants might be something that you've heard of in the past. But if you think about it, if you have trouble being able to have food or have healthy food, you have trouble with housing, and maybe you have unstable housing, you don't always know where you're going to live, or as we all saw within the last couple of weeks, we had a lot of people that had without power for extended periods of time. All of those things can really influence not just your body, but also your mind. And so making sure that you look at those risk factors when they are happening to make sure that that you're recognizing that those can be affecting both the mind and the body. As we mentioned before, how important sleep is, sleep and nutrition and physical activity can really impact both of your mental health and physical health. So it's really important to make sure that we're having adequate sleep every night, that you're limiting things that may cause you, such as like caffeine or screen time, watching TV really late at night, that can really impact that sleep where you're not getting good quality sleep. You're going to see an increase in physical health symptoms, as well as seeing an increase in depression or anxiety when that sleep patterns are not in a good place. Also, nutrition, making sure that we're finding ways to have good, healthy diets, increasing our fruits and vegetables, making sure we're trying to have some protein, increasing our water intake. All of those activities will help your mind and your body. And making sure that you don't have a sedentary lifestyle, that you have some kind of physical activity. Walking is a simple activity that we can all do. You may have to start out with slow, taking small steps, increasing the amount of steps that you take every day. Try to figure out when are good times to be able to have some of those physical activities. Is that an opportunity? A lot of times people have discovered that, taking a short walk after a meal will really help you feel energized. It helps your food digest better. It can increase your mood. So as we're getting closer to having spring and having some of that warmer weather, finding opportunities that you can increase your physical activity will really affect your emotional and physical health. And one thing that we really have to look at is substance use at times. Um, Substance use, as we can see, sometimes individuals end up using a substance as a coping strategy for maybe some emotional distress or maybe a physical condition that they have. And so all of those things can really cause an increase in complications. And so, making sure that you don't turn to substances when you're having these issues, and that you're really looking at it in a way that what other coping strategies can I learn and can I use instead of moving towards a substance use issue. One of the things that unfortunately we've seen is that individuals that have a serious mental illness, they're at increased risk for metabolic syndrome. And I don't know if many of y'all have heard of metabolic syndrome before, but it is basically a cluster of conditions that is related to blood pressure being high. Also, your blood sugar is high. You also see excessive weight around your stomach and abdomen region, and then also your cholesterol levels. So, high cholesterol is elevated. And so, individuals that are taking medications for some of their psychiatric issues, those medications have some side effects, and those side effects can cause individuals to have an increased appetite. It also can kind of slow down their metabolism. And when it does that, an individual will start to have weight gain. And also, it can cause issues with insulin, which is what makes your blood sugar go up. And then it can have those lipid changes, so affecting someone's cholesterol. So, the medication, while it's helping treat some of your mental health, it can have some of those physical health problems that start to creep up. So that's where it's even more important, if you are taking any of those medications, to really make sure that you are going to the doctor, that if the doctor wants to do a lab draw where they draw some blood to be able to check your levels, that you make sure that you're doing those so that way they can catch things early and really decide what medications they may need to change, or if they need to add any to make sure that they're not increasing your risk of developing the metabolic syndrome. And then this also plays into that factor where you want to make sure that you are not having sedentary life, where you're not doing any kind of movement. You want to really make sure that you're increasing your physical activity and that you're watching the things that you eat, because that will play a really important role in that. And so if you're on these medications, your provider that is providing your mental health will be drawing labs and looking at that, and they may be in collaboration and talking with your medical doctor, your primary care physician, to make sure that both individuals know the medications that you're on and how those are being treated. So, what can we do to be able to help individuals be able to make sure that they are looking at the whole person? One of the things is integrated care. So at Centerstone, a program that we have is called HealthLink. And in HealthLink, you would have a case manager that's assigned to you. And this case manager is going to be your person to be able to help you make sure that you're keeping your appointments with your therapist, with your nurse practitioner, whoever is prescribing your mental health meds, but they're also going to be in court talking with your primary care physician. And that's called care coordination. And when they do that, it makes sure that all of your providers know what's going on with you. And so having a person as a case manager being that advocate for you is really helpful. If you have questions about your appointments, you're not sure which medications that they had given you, they can make sure that you are getting those filled when you're supposed to, and really be able to help you navigate some of the symptoms and activities that you may be having. Um, they also can help assist you with some of those other things that we talked about, whether that's, making sure that you have opportunities to get food, check with you to see if there's housing applications they can help you fill out, doing all of those things, working on what I had talked about before, such as those social determinants of health. So that way it makes it easier for you to be able to go to your appointments, stay on your medication, and feel the best that you can. Some of the other benefits is really helping to make sure that you keep those appointments and stay connected, because that will help reduce you having to be hospitalized. And that's one of the things we really want to prevent is unnecessary hospitalization or going to the emergency room. As we all know, sometimes sitting in that emergency room can seem like you're there forever. But if you were able to get in with your primary care doctor, or your mental health doctor, and they're looking at a lot of those conditions that you have and doing some of those screenings early, that might prevent some of those hospitalizations and emergency room visits. Um, so a person that, a lot of times individuals will have both a medical condition and a mental health condition at the same time. So like I was talking about, a individual could have diabetes and they also might have depression. And when an individual's blood sugar is in control and in normal ranges, a lot of times their depression is being treated and it's also improving. So the mind and body is being improved at the same time. And by doing this, individuals have that whole person support. So they're looking at both of the areas together at the same time. And that, like I said, hopefully this would prevent duplications in testing, because they could share that information and then you would not need to have additional tests done. And being able to have your case manager working with you and working with your providers really does provide that whole person support. So, some of the key takeaways as we talked about today is that physical and mental health are inseparable. They function, your brain and your body function as one, and so they all really must be addressed together. If you have an untreated mental health, that's going to cause physical outcomes to be worse and medical conditions to be worse. If you have an unmanaged and untreated physical illness, that's going to increase your risk of depression, anxiety, and stress. So making sure that any of those shared risk factors are really being looked at. So trauma, income, making sure that chronic stress and that you're attending all your appointments is the area to be able to make sure those risk factors are decreased. And then individuals that live with a mental illness, they're at risk. So making sure that you have those physical health preventive labs, blood pressure checks, blood sugar checks, so that way they can monitor those. It's very essential to making sure that you are getting treatment early. And then finally, we really want to make sure that integrated care is something that is really important and that really collaborating to make sure that the whole person is being looked at is the message that we really want to make sure that we have so we can really support a sustainable recovery. And when we treat the whole person, mind and body together, that's how we promote dignity and really promote long-term wellness. So I know we might have a few questions in the chat, and I'm happy to quit sharing my screen so we can all see each other. And if you didn't type your question in the chat yet, please go ahead and do so now. Or happy if anybody wants to come off mute and ask any questions. Dawn, I'm not sure if you're talking, but you're on mute if you are.
Even though I'm in Zoom all day long, every day, I still forget the mute sometimes. I appreciated what you brought up about protein earlier in the presentation because I am someone who my loved ones know that when my anxiety, especially my OCD, is flaring, to ask, when was the last time you ate?
Yes.
Protein has helped soothe my anxiety in the OCD episodes.
Yes,
The other
that's
thing,
one thing I ask my child all the time when she's becoming really anxious or feeling bad. I'm like, when's the last time you ate and how much water have you drank today?
exact and hydrating, exactly.
Yes,
And the walking part. I
absolutely.
actually was offered. I was the second choice 5.5 years ago for the position I took. It was a part-time program manager. I kidded my former executive director about it that she did not choose me originally, but the other person found a different job, and I was offered it second. But one of the reasons I stood out was during my interview, I mentioned that because I had an interview and I was feeling anxious, I'd taken a long walk right
Yes,
beforehand. I cannot stress that walking, especially with my depression and suicidal ideations, helps me manage those a whole lot better. When
it
I Getting out of bed and exercising, even though there are days I don't want to, is a game changer for me.
absolutely. And that's where I'm saying, like, even when you don't feel like it, doing a small walk, seeing a little bit of sunshine, all of those things really can play an important role in making sure that your depression, your anxiety, but then it also, when we start moving, getting our joints moving, doing some stretching exercises, when we're doing our deep breathing, all of that really does help make sure that our physical health as well as our mental health is at the peak and the best it can be.
Anybody have any questions for Mandy? Yes, Miguel.
I have a question. Now, I've got a family member that was receiving mental health services, but they were unsatisfied in the way that they were receiving it because it was telehealth. And ever since then, they have shut down to mental health services. They'll only talk to me, and
Mm.
I'm feeling like I'm kind of overwhelmed myself, but I want to be able to help them, but I don't know how.
Well, I know that, during COVID, a lot of organizations had to move to telehealth because that was the only option. But a lot of organizations, including Centerstone, we've moved back to where we give the individual the option. So some people love telehealth and that's where they want to stay and they're doing really well. But some people are like, I want that in-person visit. And so we offer both. So I would encourage you to encourage them, like look for a provider that offers that in person. And sometimes, you might have to look for a provider that you're going to connect with. And so, give it a try different providers to see, is there one that you connect with? And really, continue to encourage. It's great that they have you to talk to and they feel comfortable talking to you, but I would continue to encourage them to try to see which organizations are providing in person and look for those opportunities that maybe they could attend one of those type of appointments.
Well, with them, it's also an insurance issue as well.
Yeah. Well, yeah, as we all know, insurance can be a burden for some individuals. There are different types of insurances that are out there. So, a lot of organizations are part of the Tennessee Behavioral Safety Net. So, if individuals don't have insurance, that's something that they could try to help them apply for, depending on their income and if they qualify for that type of insurance. And that's something that's provided through the Tennessee Department of Mental Health.
And it also sounds like, Miguel, you may be suffering a little bit from caregiver fatigue, which is very
Absolutely.
common. And
Yes.
being the trusted loved one is both a blessing and a curse.
Yes.
And I've been on both sides of that, where your loved one wants to only talk to you, but that can be a little overwhelming sometimes. So you've got to take care of yourself too throughout it all. Do you have any other questions? Brad, and then I'll go to Bella.
Perfect. Hey, Mandy, it's Brad. Thanks for your insights tonight. Appreciate you being here. I'm going to ask a really stupid and basic question,
Oh,
but
no, nothing stupid or basic.
talk to me about motivation. Like, what's the mindset to get motivated, like to get out of bed and like, you tell yourself, hey, I need to go on a walk, and then you still find yourself sitting on the couch being unmotivated. Like, how do you get over the hump? Like, just any insights there?
Yeah, I mean I think that we can all agree that's the hardest is trying to
Right,
find that little spark of motivation. And that's where I've seen make it a small step. I think sometimes it's a lot easier to start off and say, okay, I'm going to walk around the block. That's not as big of a motivation. But then once you get out there, you're like, oh, this wasn't as bad. I feel better. Or like, what is something that you're looking forward to? Maybe there's music that you really like, or a book, or a podcast, or something that you really are interested in looking at or listening to. You know, try to do that with that activity, and sometimes that can increase it.
hmm
Set a goal for yourself, and try to move towards that. But yeah, motivation sometimes can be very difficult, I think, for all of us. But maybe starting with smaller steps that can real and then usually once you accomplish one of those, then that can encourage you to accomplish your next step from there.
got it. Thank you for that.
And Brad, I will sometimes say, because I'm someone who manages depression and suicidal ideations that come along with that depression. So I will wake up
Right,
in the morning and already feel like,
right,
why bother? And sometimes just getting from the bed, my former executive director, Robin Noblin, who's now retired, always said, sometimes the challenge some days is getting from the bedroom to the kitchen, but you got to the kitchen.
Yeah.
Maybe you can now make it to
right,
the
right,
mailbox.
Right.
It is the baby steps
Yeah.
sometimes. And
right,
I cannot tell you how many times I wake up thinking, why?
right.
But
No,
but
yeah,
but I've learned that if I stay in bed, and it goes along with the physical health. When I get sick
Yeah.
and have to be in bed, my mental health is right behind it, and it tags because I
Absolutely.
need to be that I have too much time to ruminate when I'm in bed.
Yeah.
right, right.
Yeah.
Gotcha. Yeah, that I'm with you on the rumination part too. So, yeah,
Yeah.
appreciate that.
No problem. Bella, did you have a question?
Yeah, well, first of all, I just want to say thank you so much for your information tonight, Mandy. It's always really good. So it's just great hearing from you. I live with type 1 diabetes, so I
Oh,
have one of those autoimmune
Yeah.
conditions, and I was wondering, the questions about motivation. I mean, even just last night, I was up till 3 dealing with blood sugars, and then that affects the sleep, and then that makes
Oh,
me oversleep. And
yes.
I was wondering what's a good way to kind of prevent that intersectionality spiral where, oh, I'm taking care of my physical health and that keeps me up late, which affects my sleep, which affects my mental health. And is it just one little intervention will be all I need?
Well, I wish I could just give you one little intervention and
yeah.
that would make everything so easy. But unfortunately, sometimes that's not the case.
Yeah.
And it's like sometimes you're going to have a bad night of sleep. So then what can you do to make up for it the next day? So like you being up till 3 a.m. because you were having complications, is there anything you could have done during the day that might have prevented that? Did you make any choices with your diet or your medication or your insulin that could have impacted that? So thinking about that, so then you could look at it. But then as you're, today you probably had things you had to accomplish. So is there activities that you could do to then help you? Do you have a time for a small nap to catch up? Do you have a time that, okay, well, I really want to attend this, but maybe I realize sleep's a little more important. So, or maybe I'll cut down on some activities at night that may then cause me to stay up late the next night again. And so trying to find that balance, um, as you know, trying to manage type 1 diabetes, that's just a lifelong activity that you've been doing. And, any type of different kind of regulation you can see can cause your blood sugar to go up, and then it could cause it to go down. And so trying to find those abnormalities, and if you can figure out like, oh, this is something that always triggers it, what can I do to prevent that? I think that helps. But then, that motivation to really be like, okay, maybe today I did something. I was like, oh, don't allow it to like cause you to now become more depressed or more stressed or more anxious. That was a day. Let's start today as a fresh day and see what new decisions I can make. And hopefully that can, not keep you where you're in that slump.
Yeah. Yeah, that's really good. Thank you.
Absolutely.
And a lot of us with mental health issues have to come up with a good sleep routine. And it's
Absolutely.
different for everybody. Some
Yeah.
people need 12 hours sleep. Some can function on 4. I am someone who's a night owl. So the more I try to squeeze out of today, the more I pay for it tomorrow because I still have to be up at the crack of dawn. Plus,
Yeah.
as the older I've gotten, I don't sleep in.
Yeah.
Part of that is having been a parent, etc., and having to get up. But now that as I get older, I know that if I don't keep to that sleep routine, I'm gonna, especially my anxiety flares with lack of sleep.
Oh,
So
absolutely. I was a nurse for many years at night, for like 10 years. And so I never had good sleep because I was
yeah,
always switching between night and days because I had
yes,
kids. And so I could just see during all of that time how such poor sleep made a difference in all activities. And once I was able to get into a job where I worked days and no longer had that, it took me a little while to even get my body adjusted to sleeping longer because I had gone for so many years with that. But it just made a huge difference being able to actually get good quality sleep. And so making sure that what can you do to make sure that you get that good quality sleep? One thing that I do, which I know not everybody agrees with, is like I can't let the animals sleep in my bed because that will cause me to not have a good night's sleep. And as much as I would love to have all my animals in my room, they will keep me up all night. So I'm like,
yep.
okay, which is better to have the animals during the day and we all cuddle then, and then we all get good sleep in our own beds. And so that's one of the things I realized I had to do. And so every person's a little individual to figure out what's that best sleep routine for you, and trying to find a way that you can incorporate that. Because as Don, I don't know about Don, but I don't think there's many people that it's going to do well on 4 hours of sleep. You
Yeah,
really
yeah.
need to make sure you're trying to get 8 hours of sleep a night, and that can make a big difference. And I know one thing they say is like keeping that same routine where no matter if it's weekends or the week, you go to bed at the same time, get up at the same time. It really does help that regulation the more that you can try to do that.
Yes, Miguel.
I can agree with that because for one thing, when I had to care for a loved one for several years, I had lost a lot of my sleep patterns because I was trying to care for that loved one, and when they passed away, sadly, I was stuck trying to regain my sleep patterns.
Yeah.
It is a big deal. And again, I share this in some other groups. My suicide attempts were when I was working third shift. and having trouble sleeping. And I also was on the routine caffeine to go through the night and alcohol to come down.
Yeah.
And and now I limit caffeine and alcohol a lot because I learned the hard way what
Yeah.
they do to both my sleep pattern and just my mental health issues, what they do
Absolutely.
to them. So.
Yeah. And when I worked in the hospitals at night, I was always like really promoting with my patients, let's get you to sleep as early as we can because your body needs to repair while it's here. And let's try to get, and sometimes the hospitals, the hardest place to sleep because we're always bothering you. But I was always like, let me be as quiet as possible and try to make sure that you get a good quality night's sleep because that's really going to make your physical and your mental health do much better the next day.
All right, do we have any other questions or observations? I think I've got something in the chat I may have missed. Can you talk about the role cortisol plays in mental and physical health? And can you talk about what the physical results impacts of burnout are?
Yeah, so cortisol is one of those that's released a lot of times when we have stress. And so it's going to cause you to feel bad when your cortisol is high. It's also going to cause your mental health symptoms to increase. So you're going to see increased depression and increased anxiety. And so, what are some of those ways that you can help to reduce your cortisol? As we talked about, sleep makes a big difference. Also, what are some coping mechanisms you may have learned? Some breathing activities? How are you able to try to reduce that stress that you may be having? Taking some slow, deep breaths, looking around in your area to find things that may help stabilize you. A lot of times people will be like, how many, finding things I can see, that I can smell, that I can hear, just to kind of regulate your body and get you back into a less stressful phase. That's going to help lower that cortisol, and that's going to help you to try to, regulate that stress that you may be having. Um, and as we all know, burnout, whether with that's with your job, with caring for someone else, you may be going to school, you may have a chronic illness, all of those things can really impact your burnout to where you just have no motivation. It just increases your depression. It could cause suicidal ideations to creep up on you. And so, what are some ways that you can try to focus on yourself and focus on that self care to really try to not feel so burned out? Is it what brings you joy that you can do to help you kind of move into a different phase? Is it listening to music? Is it coloring? Is it reading? Is it sitting out in nature? I know for me, like being out in nature has always been like a real calming impact for me, and I feel a lot less stress. I feel my levels going down if I could just kind of sit and not really do anything but listen to nature, listening to the birds, listening to the different animals, just kind of hearing the breeze in the air and, going through the trees and that kind of stuff. And that really kind of helps center me. And so finding those activities that can help center you. Is there things that you can do less of that can cause you to not feel so burned out? Is there things that you can try to, put on a shelf for a day and not try to focus on to really try to not feel that impact of burnout? Yeah, coloring and listening to music are two of your coping mechanisms. Do you do them together sometimes too? Yeah.
And I will say, the last couple days sitting on my back porch has been a nice change of pace. And I'm someone who's raised in the north and enjoyed the winter weather since I did have power. I know it wasn't enjoyable for a lot of people, but
Yeah.
being able to sit outside and just fresh air, the birds, etc., it helps my mental health a lot. So I take advantage of it. Depending on what type of weather you can sit through and how much you can bundle up. I have sat on my back porch looking like I'm going across the Atlantic on a steamship before, just because I knew it would help me regulate all of my mental health issues.
Yeah, absolutely.
So, do we have any other questions for Mandi? I will take that as we have thoroughly answered, and it was a great presentation. We appreciate it, Mandy. Before we close the evening, I do want to mention a couple things. We do have our annual Well Within Awards next Wednesday, February 25th. And I want everyone to mark their calendars. We are open for registration for our walk on May 9th, at the second Saturday of May at First Horizon Park. That's our biggest uh, community awareness event and fundraiser of the year. So we want everyone to join if they can. Uh, Everyone on this call tonight who registered is on our newsletter anyway, so keep an eye out for other events in our groups. Plus, after the presentation tonight, I will be sending you all the PowerPoint that Mandy shared so that you can follow along with the YouTube audio version that should be posted sometime tomorrow to our YouTube channel, NAMI D Info. And there'll be a link to that in this coming Monday's newsletter. With that, we do not have any current ed session on the calendar, but we are working on a few more before the end of the fiscal year in June. We're working with Vanderbilt Behavioral Health and some other other community partners, but we're always open for suggestions. This was a suggestion. Our development manager, Ashley Hall, put me in touch with Mandy and Centerstone, so we were able to put this on. We always appreciate Mandy and other professionals volunteering their time, especially in the evening, outside of working hours to do these for our members and the public. So I want to thank Mandy for taking time tonight with a thorough presentation. We really appreciate it, Mandy.
Yes, thank y'all so much for having me. Hope y'all have a great rest of your night.
Everyone have a wonderful night. Take care.
Bye.